Hello, and welcome to the AIDB UAT testing guide video for medical processes. Today, I will be covering the processes for both the nurse and the mental health counselor. I'm going to start with the processes for the Gentry nurse. Now, the Gentry nurse has their own application in the system, so you need to make sure you're in the Gentry nurse ECM app. Mental health counselor has one too, which we'll go into in a minute. Now here on the home page, we have a number of different tabs. The one I'm going to point to right now is the case record tab. Once a consumer has been enrolled, they will have a case record, and the nurse intake button will be visible just for the nurse on the nurse application. Once we click this nurse intake, we're taken to the nurse's intake form. Here we will see all of the contact information that's been entered during the intake process. A normal record would be more filled out than this. We can update any of the information based off of information we have in the first section, and then we're in the medical information section. Here we select the medical insurance type. We can add an auto insurance number, policyholder, preferred hospital, special diet, allergies, and then any medical contacts that we want to record. This field will be saved on the consumer's contact record, and it is only visible to the nurse. Here we have the case information, which we won't be changing. Below, we have the case participants. We can add case participants here for contacts that are able to be seen by the whole system. So any private contacts we'd want to add up here in the special nurse field. We can also add diagnoses by pressing the button for Add Row. This is going to load a sub form where we can select a diagnosis type and any notes associated. We must then press Apply to add that to the intake form. Next, we can add any medication prescriptions. Note that both nurse diagnoses and medication prescriptions will only be visible to the nurse. We must link to a medication record, and I'll show you how to add those in a minute. Both diagnoses and medical prescriptions can also be added after the fact from the case record. I'll show you how to do that as well. If we added a medication record here, a medication prescription, we would press Apply and it would save it to the record. We can also list any consents that we will be adding. We can select the type, like a HIPAA notice. We can add our staff person here by selecting typing in our name and selecting this magnifying glass, which will open a pop-up window where we can select our user. We add a status. And if this has a signed date or an expiration date, we would add that as well as any notes. We then press Apply. This will save the note to the record, or the consent to the record. Here at the last section we have is the nurse intake note. We can add a date, a type, a one-on-one with consumers, the value I'm selecting, any staff that were consulted, time that was spent, symptoms reported, respirations, temperature, blood pressure, blood sugar, heart rate, treatment explanation, and notes. Once we've filled out all of this information, we select Save and Close. This will add all of the records that we've added here, as well as update records. And I'll show you where those records are saved. Any consents we've added will be here in the documentation tab. We can select those and navigate to the files related list to upload any copies of these documents. In the medical information tab, we can see the diagnosis that was created and add prescriptions. I'll show you how to do that in a moment. In the notes tab, we can see our medical note that was added here, and we can always add a new note throughout our time. So if we come here and select nurse note and press next, we can add additional nurse notes. We can also see their general services and assessments and other things that other case workers are added to their system, to their record here in the Plans and Services tab. We can see additional information in the History tab, as well as case participation records we've added that are public. If we want to edit the private field for medical contacts, we need to go to the client record, to the medical information section, and then we can see this client's medical contacts nurse field that no one else can see. So we can edit that here by selecting the edit button. Now I'm going to go back to the case record to show you how to add medication prescriptions. We'll click on the medical information tab. There's the diagnoses, and then there's the prescriptions. Next to prescriptions, I select new, and it opens a window. We need to search for medications here or enter a new one. Now, if we enter a medication, we never have to enter it again, and we can reference it for other consumers. In this case, I'm making a medication record for Advil. I can add common interactions and common side effects and any notes and save the record, and it will return me to this medication prescription record, where I can indicate the dosage, prescribing doctor, frequency, time administered, route, and notes. After I'm done, I can save this record, and it will be listed here under the prescriptions related list on the medical information tab of the consumer. If I need to add more diagnoses, I can also select new next to diagnoses and select nurse diagnosis, click next, add a type, and add diagnosis notes. This will save it under the diagnoses related list. Now, again, if we need to add an additional note, we will come here to notes, we will click new, we will select nurse note, and then we can add the date. It's automatically connected to the case record. We can add a note type, the time spent on the note or on the meeting, the staff that were consulted. And then if we're adding medical data on this note, we can add our symptoms, respirations, etc. We also have a section at the bottom for a treatment explanation and any notes. In this way, we can save a history of our interactions with consumers in this medical notes section on the Notes tab of the case record. That concludes a demonstration of the nurse features in AIDB's new database. I am now going to demonstrate the mental health counselor's functionality in the system. To do that, I need to navigate to the Mental Health Counselor ECM application, which will just be used by the mental health counselor. After a consumer has completed intake, they will have case records, which can be seen here in the Case Record tab. Some of the things that the mental health counselor can do in the system is add mental health diagnoses, notes, and also groups and group services. We can also add medical contacts and behavior contracts. I'm going to review all of those features now. To add diagnoses, we will click on a consumer's medical information tab on their case record. Now, I'm a system admin, so I can see all of these, but nurses will only be able to see the nurse records. Mental health counselors will only be able to see mental health records, and nobody else will be able to see any of them. These will be private. We select new and select mental health diagnosis and click next. It is automatically attached to the case record of the consumer. So we select the type of the diagnoses, and then we add the diagnosis notes, and we save the record. It will then show here on the diagnoses related list. To add mental health notes, we will go to the Notes tab and click New. We will click Mental Health Note and select Next. We can add the date that this note is taking place, it's automatically connected to the case record, and we can add the note type. I'm going to select 101 with consumer. We can select the amount of time spent, staff consulted, and any notes, and save. Then it will show here in the medical notes section that only the mental health counselor will be able to see. Now, the mental health counselor can have group services that they provide. For this feature, we need to click on the Group Services tab, and we can add a new mental health group by selecting New. We will call this Mental Health Group November. We will select the Adult Services Program and the Gentry Program site. We will also select the mental health group and services provided and add a status of active and a start date. We can add a description and we can add recurrence information below, as well as capacity. When we save this record, it will bring us to that record, and now we can go about the rest of our tasks here. If this is a group that has scheduled regular sessions, we will click the Schedule Sessions button. We will select Mental Health Group. Click Next, and we are brought to a scheduling form. We can select the reoccurrence. We'll say this is a weekly group for the month of November that transpires on Wednesdays at 11 a.m. And we're going to start this November 1st and end this November 30th. If we click Create Event, it will add this as an event on our Salesforce calendar. We can add ourselves as a staff assignment by clicking Add, looking up our staff name in the system by typing in the name and selecting the magnifying glass and selecting our name. We'll add a start date and an end date. And a status of active, and press Apply to save that staff assignment. By pressing Save and Close, it will create sessions on Wednesdays throughout the month of November, which we can then see in the sessions related list here. Now, when it's time to record attendance for a session, we will find that session in our Sessions tab and press Record Attendance. This will open a new tab in which we will confirm the date and time and add the total attendance of the group, in this case 4 consumers. We will also add the staff time, which is 15-minute increments. In this case, it was an hour-long group, so I'm adding 4. We can add session notes as well. Then we can save and close, and that has saved our information about that session of our mental health group. Now, a couple other things. For a single consumer, if we want to edit specific mental health contacts that pertain to them, we can go to the client record, the contact record, and scroll down to the medical information section. There's a hidden field here that is only visible to the mental health counselor called Client's Medical Contacts. We can click the Edit button next to it, and we can add information about psychologists, psychiatrists, nurses, and other people who are important contacts that only you want to be able to see. And you can save, and that will be always visible on the contact record just to the mental health counselor. All right, the final feature I want to show you is how to add a behavior contract. To do that, we navigate to a consumer's case record, and we click on the Plans and Services tab. Now, a behavior contract is a type of service plan, So on the service plans related list, we will click New and select Behavior Contract and select Next. And we will be taken to our main behavior contract record. We will set a status of in progress, a start date of today, an end date if we have an end date. We can add an expected end date if we prefer that. We will connect it to our staff record. We can select the date that it was signed by a client and signed by staff. And then we can add our behavior contract information, as well as the plan review date, and then review notes and history. Once we've filled this all out, we can press save. And then we can open that behavior contract to see our information. And we can always edit it here as it is signed, achieved, etc. Note that the status has to be closed in order for the case record to be closed. So these cannot be left open indefinitely. And when the case manager goes to close the record, they will need this behavior contract to have a status other than in progress. It should either be completed or not completed. All right, that concludes my demonstration of the medical processes in AIDB's ECM system. I invite both the nurse and mental health counselor to go through the AIDB testing guide and follow the processes that are pertinent to them. Please make sure that you are either in the mental health counselor app if you're the mental health counselor, or the nurse app if you're the nurse. And we invite you to confirm that your information is not visible to your colleagues, and let us know if there's anything visible that should not be. We have tested that though and have found that the security is working. All right, thank you so much, and happy testing.